Gamete interfallopian and zygote transfer. Gamete interfallopian transfer, GIFT, is a three-step procedure that involves removing the eggs, combining them with sperm, and immediately placing them in the fallopian tubes, where the egg is fertilized. The woman is given follicle-stimulating drugs to increase her chances of producing multiple eggs. Uses multiple eggs collected from the ovaries. The eggs are placed into a thin flexible tube, catheter, along with the sperm to be used. The gametes, both eggs and sperm, are then injected into the fallopian tubes using a surgical procedure called laparoscopy. Zygote intrafallopian transfer, ZIFT, is similar to GIFT, but also uses in vitro fertilization, IVF. Eggs are stimulated and collected using IVF methods. Then the eggs are mixed with sperm in the lab. Fertilized eggs, zygotes, are then returned to the fallopian tubes with laparoscopic surgery. Gamete interfallopian transfer, GIFT, and zygote intrafallopian transfer, ZIFT, are adaptations of IVF. GIFT and ZIFT are used in unexplained female infertility and in mild male infertility. The success rates are similar to those of IVF, but a woman must have at least one functioning fallopian tube. Surrogate embryo transfer. Surrogate embryo transfer is an assisted reproductive technique for a woman who does not produce ova. For the process, the oocyte is donated by a friend, relative, or an anonymous donor.
The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct. But that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. The technique of in vitro fertilization, or IVF, removes several eggs from the ovary for fertilization in the laboratory. After a few days, one or two of these fertilized eggs, which are now known as embryos, are returned to the uterus in the hope that they implant and become a pregnancy. Women having IVF are given special reproductive hormones to encourage several eggs to develop in the ovaries. Final maturation of the egg itself is induced by the administration of a further hormone. 36 hours later, fluid containing the eggs is drawn from the ovary with a needle. This is usually performed under light sedation in a short outpatient procedure with the doctor using ultrasound to check proceedings. The eggs collected from the ovary are then mixed with a sample of the male partner's sperm, which has already been washed and concentrated. The eggs and sperm are left in an incubator set at 37 degrees for 24 hours so that fertilization can take place. During this time, only one of the many sperm cells will penetrate the outer layer of the egg and achieve fertilization. Following fertilization, the cells divide and multiply and form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin, flexible tube, where it is left to implant and form a pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A consultation and thorough examination are necessary for each individual patient for finding the most appropriate treatment with the highest chance of success. Because female fertility decreases quite quickly after the age of 35, infertile couples should not delay seeking appropriate medical advice.
Implantation genetic diagnosis, the individual retrieval of oocytes and their fertilization under laboratory condition has led to close inspection and recognition of differences in sperm and oocytes. After the oocytes are fertilized in IVF, and ZIFT procedures. The DNA of both sperm and oocytes can be examined for specific genetic abnormalities such as Down syndrome or hemophilia. Ang oocyte ay isang cell sa isang ovary na sumasailalim sa meiotic division upang bumuo ng isang ovum. Ang meiotic ay isang uri ng cell division sa mga organismo na nagpaparami ng sexual na nagpapahaba sa bilang ng mga chromosomes sa gametes. Ang mga sex cell o itlog. Sa mga tao, ang mga cell ng katawan o somatic ay diploid na naglalaman ng dalawang set ng chromosomes, isa mula sa bawat magulang. Couples participating in intrauterine transfer and alternative insemination can also have the sex of their children predetermined using these methods. Such techniques can be useful because popular methods to influence the sex of a child. Asawang kasali sa altered transfer ay may kakayahan silang pumili ng kasarian ng kanilang anak. Dutching with a baking soda mixture before coitus to have a boy or with a vinegar solution to have a girl have been proven to be more folklore than scientific fact. Allowing couples to choose the sex of children has ethical concerns because it could result in skewed male or female ratios if used by majority of couples. Kaya ang pagpayag sa mga mag-asawa na pumili ng kasarian ng mga bata ay may ethical na alalahanin dahil maaari itong magresulta ng mga balungtot na ratio.
Alternative to childbirth. For some couple, even treatment for subfertility with products such as IVF is not successful. These couples need to consider still other options. Alternative is alternate, which means meron kang pagpipilian or option sa paggawa ng baby. Pag sinabing IVF or in vitro fertilization is a process by which eggs are collected from the woman and joined in a laboratory with sperm collected in advance. Nasabi siyang not successful kasi may disadvantages ito. First is financial, second is a long process, and not sure ka pa talaga sa magiging result. Kasi ang always lang nag-function dito is babae. Surrogate mothers is a woman who agrees to carry a pregnancy to term for a subfertile couple. The surrogate may provide the ova, which is the impregnated by the man's sperm in the laboratory. In other instances, the ova and sperm both may be donated by the sperm are used. Kumukuha ang couple ng pwede magdala sa magiging anak nila dahil sa hindi na nila kaya magkaanak. Siguro dahil may sakit ang isa sa kanila, masyado na silang matanda para magkaroon ng anak. Surrogacy is a type of pregnancy in which a woman carries and gives birth to a baby for a person who is not able to have a children. There are two types of surrogacy: traditional surrogacy and gestational surrogacy. In traditional surrogacy, the surrogate's eggs is used to create the embryo of the child she is going to carry, either through intrauterine insemination or IVF or in vitro fertilization, while in gestational surrogacy, is the intended parents create an embryo using their own egg and sperm or using donated sperm and egg.
Adoption. Once a ready alternative for subfertile couples, it is still a viable alternative, although today there are fewer children available for adoption from official agencies. Urge couple to consider foreign-born or physical or cognitively challenged children or children of other cultures to make their family feel complete. Adoption, pag-ampon. Nagbibigay ng pamilya sa isang bata na wala ng magulang. Adoptive family is a family who has welcomed a child born to another into their family legally adopt the child as their own. When you adopt, you give a child a sense of belonging, security, and identity. Child-free living. Child-free living is an alternative lifestyle available to both fertile and subfertile couples. For many subfertile couples who have been through the rigors and frustration of subfertility testing and unsuccessful treatment regimen, child-free living may emerge as the option they finally wish to pursue. A couple in the midst of fertility testing may begin to re-examine their motives for pursuing pregnancy and may decide pregnancy and parenting are not worth the emotional or financial cost of future treatments. They may decide the additional stress of going through an adoption is not for them either, or they may simply decide children are not necessary for them to complete their family unit. Child-free living can be as fulfilling as having children because it allows the couple more time to help other people and contribute to society through personal accomplishment. It has advantages for a couple in that it also allows time for both members to pursue careers. They can travel more or have more time and money to pursue hobbies or continue their education. If a couple still wishes to include children in their lives in some way, many opportunities are available to do this through family connection. Most parents welcome offers from siblings or other family members to share in child rearing through volunteer organizations such as Big Brother or Big Sister programs, or through local schools and town recreational programs. Many couples who believe overpopulation is a major concern choose child-free living even if subfertility is not present. Parents who choose child-free living typically rate their marriage as happier than for those with children, probably because of the decreased expense involved and the availability of more free time, which allow them greater freedom in life. Living child-free is after infertility is an option. Some people choose and some must come to accept. Free child living, it is a voluntary choice not to have children. More free time and freedom in general is a common people experience of free child living.